Hey, so when is the worst time to start Medicare and when is actually the best time to start Medicare? And if you don't get these right, you can have penalties that last for a lifetime. I'm going to break down all the different scenarios today in this video. Stick around, I'll be back in just a second. Hey, so let's talk about one of the best times to start Medicare and then eliminating the worst case scenarios when it comes to penalties when it comes to this scenario I'm going to go over. If you are working past the age of 65, understand that Medicare kind of deems this age of 65 as the prime time to be able to enroll into Medicare Part A and Part B without any penalties. But if you're working and continue to work, maybe you're going to work to 67, 69, 70, or if you heard me talk about my mom, she worked to 78 and was on an employer-based plan until she was 68. You can actually suspend or not enroll into Medicare Part A and Part B. Now, another moving part that's happening now is people that are born 1960 and beyond, their full retirement age for Social Security is based at 67. So if they begin to draw their Social Security early and they're going to draw their Social Security at 65, when they enroll into Part A and Part B because they retired from their career job at age 60 and they're just waiting until Medicare can start at 65 and then they're going to start drawing the Social Security, they're actually taking a 6% or 12% because it's 2 years decrease on their Social Security earnings because the full retirement age is 67. Side note, we talk about full retirement age on other videos, but it's good to know. So a lot of times people think now, hey, I'm not drawing my Social Security until full retirement of 67. I'm going to wait and draw my Part A and Part B of Medicare, even though I've retired. Well, guess what? You're going to have 2 years of both Part B penalties, and then you're going to have to enroll into Medicare Part B, not on your birth date month or not on the month that you choose to start your Social Security, but you're actually going to have this general enrollment period, which is from January 1st to March the 31st every year. That's when you would actually have to enroll in your Part B if you miss your enrollment period time, and you're going to pay a 10% penalty accrued every 12 months on top of the Part B premium. So right now the Part B premium is $185. We're in the 2026 AEP season time frame right now. We haven't been told what the increase is going to be, but there's going to be an increase of that. So they're going to add for every 12 months to whatever the Part B premium is. There's going to be a 10% increase for each month. So I've had people tell me, hey, I was told I could wait to start my Medicare A and B when my full retirement age for Social Security began, because that's when I was going to draw Social Security. And that's a big no-no. Don't do that. Start, if you don't have credible coverage, you have to start your Part A and Part B when you turn 65. On your 65th birthday, your Part A and Part B should begin. And then also with that is Part D. If you don't start your Part D when you're 65 and you don't have credible coverage, guess what? If you don't start a Part D drug plan, you're going to have a 1% national, basically a 1% penalty based on how many months you went without prescription drug plan. So this 67-year full retirement age scenario would mean you would have gone 12 months or 24 months without Part D coverage. And then depending on when you landed on a Part D plan, if you had to wait to the AEP season, it may have been 26 months, 28 months, or 30 months without a drug plan. You're going to have those months times the national prescription plan premium average. Now that usually runs anywhere from about $37 to about $42.50 or $44 a year. So that gives you about 35 cents, or 1% of that is going to be about whatever 35 cents is usually what I use as a scenario. So you would have that many months times that percentage. It adds up after time. And I've seen people wait 5, 6 years, 10 years, and then they're like, I didn't need a drug plan. Well, you need a drug plan so you eliminate the penalty, and then you don't have a crystal ball looking into the future, figuring out, am I going to ever have a medical crisis or a situation where I'm chronically ill, that I'm on a name brand medication that costs several hundreds of dollars without a drug plan. So I'm going to dive back into exactly, now that you kind of have a basis of understanding of Medicare, what happens to you when you're enrolled into an employer-based plan and you're extending out coverage through your employer-based plan. Stick around in just a second. I'm going to go over 3 key things to keep in mind when it comes to employer plans, and when is the best time to keep that and when is the worst time and you should be going on the original Medicare. So kind of keep in mind with an employer-based plan, the best time is when you have a great large employer group and your employer insurance is costing maybe $100 or $200 a month, because you can suspend or not take Part A and Part B and be fully covered by a credible coverage plan with an employer plan. Keep in mind 2 rules when it comes to that. If they have 19 employees or less, you have to go on original Medicare Part A and Part B, because Medicare is in the first payer position and your employer plan would be in the second payer position. So by rule, you have to enroll, because if they can't bill through Medicare first, your employer plan will not pay after the age of 65 if your group is 19 or less employees, okay? 20 or more, you can choose. And then I tell people, look at three kind of key things. One, how much are you paying per month? If it's right around the Part B premium and you have a very small deductible and very low cost risk on your employer-based plan, great, keep it. So it's kind of like premium, deductible, and then cost risk. Those are three things. Premium, deductible, and cost risk are going to reflect whether or not I keep this plan. So that's going to be a major deciding factor to determine. Now, the other thing is, some employer group plans, they're tied around group benefits like dental, hearing, vision, life insurance, and things like that. So it's kind of like this package that they're providing you. And if you take one away, you're having to take all of them away. So you need to understand, how is your package with health? Is it health and then ancillary and life separate, or is all that tied together into your employer package deal? You need to ask questions from the HR, and a lot of times the HR will boot you over to your benefits coordinator that helps coordinate all that stuff. And sometimes you have to ask a couple of people. So you need to ask the right questions. One, if I were to drop my insurance, does that affect my employment benefits, like my life, my dental, ancillary? Does it affect any retirement I'm paying into? I want to make sure nothing is tied together. And can I separate the health insurance if I so choose? And can I stay employed here without the health insurance? And then doing the math. Sometimes we talk to people and say, if you're paying $250 or more and your deductible is higher than $2,500 a year, then you may need to look into going on to original Medicare Part A and Part B, and then maybe picking up a Medicare supplement or a Medicare Advantage plan based on your situation, and then doing the math. Here's what it would cost you if you stay on your employer plan. This is what it looks like if you're on a Medicare Advantage plan. Here's what it looks like if you're on your employer plan, based on here's what it looks like if you're on a Medicare supplement plan. Keep in mind, when we start looking at these numbers, $250 premium or more, or a deductible that's higher than $250 on an employer-based plan, with that employer still paying 80-20, or the employee paying 80-20% on major medical issues. Like I go to the hospital, I'm paying 20% up to a max out of pocket. So if the max out of pocket is extremely high, let's say it's $10,000, you have to access care of the plan by meeting the deductible, which is $2,500, and then you're insuring the risk between the difference, and you're still paying 20% up to that max. Then we would do the math, and we'd say premium times 12, deductible is a liability, and then you have this liable risk up to a max out of pocket for the year. Then we may say, hey, look, let's look at original Medicare, $185. A Medicare supplement, $130. A drug plan, maybe $5. Your max premium could be, anywhere from about $200 and something or $330. But then you basically have 100% coverage, or you're meeting the Part B deductible, which right now is $257. So we would do the math, and the math typically will tell us, based on this $250 to $2,500 or max out of pocket kind of equation, you're better off going on to original Medicare and then picking up a Medigap or Medicare supplement, or looking at a Medicare Advantage and understanding your risks. The max out of pocket you'd pay on those would be up to usually about $5,000 or $6,000. Now I'm going to dive into what happens if you're beginning to look at transitioning for retirement, and then what to do, what is best, what is worse. Stick around. All right, so keep in mind, this is so important before I make this statement about what is best and what is worse and what you don't want to do when it comes to coming off your employer plan. Let's say you decide to stay on the employer plan. You have an excellent plan. You're going to stay on there. You're insured, and you're getting ready to retire at 67 years of age. Well, before that, understand at 65, if you are unaware of what the rules are when it comes to Medicare, your employer-based size groups matter, and you forget these rules, because this is what I do every day. This is what our staff does every day. You need to make sure you're dealing with a licensed professional when it comes to Medicare health plan options, like our agency. You can reach out, call, and say, hey, I'm turning 65. What is my options? And then what are the rules? What are the penalties? How do I eliminate the penalties? Understanding some of the steps just to walk through is just a series of few questions, and ensuring that you're not going to get penalized. Having a conversation is so much better on the front side. Now, with that, here's what I tell everybody. Before 65, you want to always begin that talk at least 3 months prior to your 65th birthday with a professional. And then when you begin to retire, if you stay on your employer plan and you move forward 2 years, 3 years, 5 years, like my mom, 78, my mom was programmed to call me 6 months before. And she called and said, "Hey, I think I'm going to retire." And this was during COVID. And she started talking to me prior to, and then COVID happened. And then they called her back to work, and she was going to have to wear a mask for at least 90 days, maybe 180 days. And she was like, "I don't want to do that." So we began the process of getting her enrolled into Medicare Part B at that time, and then getting her onto a Medicare supplement and a drug plan. So when her employer plan ended, she didn't have any crisis happening. So what I tell people, if you're going to be coming off your employer plan, and I know your life is busy, I know you're working and you got a busy schedule and you're trying to prepare and plan, but the last thing you want to add into the mix of that is a big old bowl of stress and stressing out over getting things done. Be prepared. Start 3 months prior to your retirement exit strategy with your employer. Talk to a licensed professional. And how do you determine if they really know what they're doing? One, I would say, do you have staff? Do you have a brick and mortar? Do you have an office? There are people that work out of their house that are independent agents that know what they're doing. But I found that typically, if you can call in, you're dealing with the agent and their staff, you're going to be better supported for customer service. They're going to be better experts when it comes to retirement, understanding the rules and regulations. They specialize, like we do, in helping retirees 65 years of age until they retire. We do hundreds of them a year, specialize in that. So the rules and regulations around things we understand, the group sizes, employer group coverages, and things like that you're going to have questions about. Your situation is unique to you, just like everyone else. So make sure 3 months prior you begin. And guess what? If you like to really plan, start 6 months out. Start a year out. When you know you're going to be retiring, the sooner you talk to somebody is the sooner you eliminate the stress and confusion and all the struggles that most Medicare beneficiaries coming onto Medicare at first didn't start early enough, and it creates so much stress that you don't have to create. Start early. Next, I'm going to go over with you what to do and what not to do, the worst case scenario with COBRA, the best case scenario with COBRA, and what to do to eliminate the penalties that most people don't know about COBRA when it comes to Medicare. So most people mess up the mindset and ideology behind COBRA. COBRA is not credible coverage with your employment. It's an extended amount of insurance that's given to you coming off an employer-based plan in situations, and COBRA does not reflect to Medicare that you've had credible coverage. So we have had people before on COBRA for 18 months, and then they're like, "Hey, I want to go on Medicare now," when they were eligible when they came off their employer plan. So get this right. The worst time to go on Medicare is at the end of a COBRA cycle. The best time to come off of COBRA and to go on to Medicare is when you're given the opportunity to go into COBRA. COBRA really applies best to people that are under 65 years of age, and they're coming off an employer-based plan where COBRA is extended up to 18 months, and there's a transition to them going to another group, going to another employer. But if you're 65 years of age and older, and you're being given the opportunity to go on COBRA, one, COBRA is expensive, and two, is not considered credible coverage. And three, you are going to be subject to penalties for Part B if you don't enroll into Part B within 8 months. And here's the caveat. You may figure that out, but then you've missed the Part D, the drug benefit time period, which is 63 days. So if your employer plan stops on October of a year, then you're going to have 2 months to get a drug plan in place, or thereafter you're going to start paying that Part D penalty because you only have 2 months to pick up credible coverage Part D. Part B of Medicare, which is so stupid they have these moving parts, but Part B, you can enroll into Part B up to 8 months. So if you lose your employer coverage and you are eligible for Medicare Part A and Part B, you have this long period of time to enroll into those parts or Part B, but then you have a short amount of window time to enroll into Part D to eliminate the penalties. So when is the best time to deal with COBRA? When you're under 65. When is the worst time to ever accept and take COBRA? Is when you're after 65. Enroll into Medicare, get into a Medicare health plan, talk to a licensed professional. Don't get screwed over when it comes to penalties and things because you're listening to an HR person that maybe doesn't understand Medicare, or a friend or family like, "I took COBRA, it worked great for me." Well, they were 40. It was under 65. It was perfect for them. It's not going to be perfect for you. 65 years of age and older, you're going to cost yourself penalties, and you're paying a lot more for COBRA than going on original Medicare and picking up a health plan that's a lot less cost and a much better benefit process and coverage than most COBRA plans. I'll be back in just a second to finish up on a couple other things that are key to making sure you understand what's best and what's worse. Hey, so let's talk about the best and worst times to be able to use your HSA or what should be converted into HRA. HSAs are health savings accounts that you can contribute into. They're great for employees because it's pre-tax. So you can actually put money in there. So if you're earning $1,000 and you put $200 in there, you're only taxed on $800. That's a simple math of how HSAs can save you in tax earnings or what the tax is going to be and your taxable income is going to be. HSAs, though, you want to begin the process of converting that HSA over into an HRA if you're going to be retiring at 65, or when you're getting ready to retire and you have an HSA. Contributions into that HSA have to stop 6 months prior when you're going on to Medicare Part A and Part B. Now, if you're still working and you're not on Part A and Part B and you have an HSA, 65 is not this deemable year that stops the HSA from working. You can contribute to the HSA until you get ready to go on to original Medicare. Again, backing up 6 months, asking the HR person or your benefit specialist to convert that over to an HRA because you can't contribute or you can be penalized. So again, penalties are so important to understand. With an HSA, it's 6 months prior to you going on to Medicare. 65 years of age doesn't mean you have to come off the HSA if you don't accept and go on to original Medicare Part A and Part B services and you just stay on the employer plan. If you're going to contribute to the HSA, don't go on Part A and Part B. Continue to contribute, and then 6 months prior to your retirement, go ahead and convert that to an HRA, and then that HRA is fine and you're not going to be deemed penalties or have any deemed penalties towards you. We're going to cover a couple other things about spouses plans and one other important thing about worst and best case scenarios of when to enroll or not to enroll for Medicare. So a lot of times with spouses, husband and wives, the husband may be retiring and coming off an employer-based plan, and they have a spouse. So what is the situation with a spouse that's under 65? And obviously what's the situation with the spouse older than 65? So one, if you're 68 or you're working because you're keeping employer-based plan until your younger spouse turns 65 and then you're going to be retiring, you're going to be coming off of a retirement plan or retiring, coming off the employer plan. You need to prepare 3 months before to begin that process. And then if your wife or husband or spouse is aging into Medicare, 65 years of age, again, keep that in mind. Whatever the 3 months is for you would be 3 months for them. And the conversation is going to be, you're coming off an employer-based plan, so you're going to be filling out, getting online, signing up for your Part A and Part B. We have a guidebook that walks you through that, or we walk you through the process. And then you're going to be filling out like your 40B form, filing for your Part A and Part B, depending on if you have an HSA or if you had Part A. And you're also going to be doing an L564 form if you are past the age of 65. So if, like me, I am 50 years of age, my wife is 3.5 years younger than me. So when I turn 65, I can go on Medicare, and I will, but my wife will remain on our group policy that we have for insurance. But when she turns 65, since I'm self-employed, I'll be on Medicare, and then she'll go on Medicare. She'll start 3 months prior, and then we'll have her enrolled on her effective date, which her birthday's in January. So she would go on to a Medicare Advantage or a Medicare Supplement and a drug plan benefit on her birth date month on January 1st. But if I work for a company and wasn't self-employed, and I was working to 68 and a half and I was coming off, I'm going to have to show from 65 to 68. Medicare is going to say, hey, have you been covered by credible coverage? And that's where the L564 form comes in. And then depending on if you're on Part A or Part B, you're going to have to do a 40B form. Again, our office helps our clients fill out that documentation correctly and then walks them through how to submit that to HR for signature and the process for that. But I would need to be able to show verification of credible coverage because Medicare is going to penalize me if I don't show credible coverage for Part D, okay? Very important to get that right. Now, the spouse aging into Medicare, guess what? They're turning 65. They have an initial enrollment period. They're not going to have any issues with having to show credible coverage. It doesn't matter because they're aging into Medicare for the first time and they're in their initial enrollment period. So there's 3 months prior. the month of and 3 months after that we talk about on other videos. Stick around. I'm going to talk about veterans and one other thing, and then close out with a very important statement about worst and best situations when to enroll into Medicare. So let's say you are self-employed and you are in a market or ACA plan. A lot of times people think because they're in an ACA plan and they qualify for Medicare, they need to stay on their ACA plan. One reason that being is they have been in a fixed income situation, they get subsidies and hardly pay anything, and they think they have great coverage. Well, that's false. When you turn 65, you're no longer eligible to be able to stay on that ACA plan. You should be dropping that plan, enrolling into original Medicare Part A and Part B, then enrolling into either a Medicare Advantage or Medicare Supplement. Now, a lot of times if they've had subsidy and they're only paying $20, $30, $40 a month in premium, and they're with a big carrier like United Healthcare or Cigna, they think, hey, I've got excellent insurance. In reality, once you go on Medicare, you're going to have much better insurance when it comes to Part A and Part B services, and then enrolling into like a Medicare Advantage plan. You're going to have a premium with that. You'll have a Part B premium. But typically those people, when they qualify for Medicare Part A and Part B, a lot of times, even if their full retirement age is 67 years of age, they're going to be drawing the Social Security at that point, and it's going to be paying the Part B premium. So just keep in mind, if you're on a, basically a self-insured option or ACA type plan, you need to transition from that into original Medicare at the age of 65, and keeping that ACA plan is really against the rules when you pass the age of 65. Again, employer-based plans considered totally different. ACA plans, the independent insurance policy that you've taken out for health insurance. It does not coordinate with Medicare. And in reality, you're dropping that and choosing a Medicare Part A and Part B plan. Stick around for one last point. I'll talk to you in just a second. So when really is the worst and best time to enroll into Medicare? One, you're probably not going to remember everything that I've talked about today. It probably spurred some questions in you. You may have some additional questions. If so, schedule a time, call in, talk to us. We'd love to be able to guide you through and walk you through your scenario. Every person's scenario is different. The worst thing a person can do when it comes to enrolling into Medicare is not dealing with a licensed professional that knows what they're doing to walk you through and guide you through the process. The smartest thing to do when enrolling into Medicare is having a licensed professional that knows what they're doing, that can identify what your problem is, answer your questions, walk you through a process to guide you into whether or not you need to go onto original Medicare. Understand if you don't, can you be subject to penalties? If you do, stay and go into original Medicare. What Medicare health plan is best for you? A Medicare Advantage, a Medicare Supplement? Do you need prescription drug coverage? What happens if you don't do that? Walking you through all the moving parts, but really simplifying that, as we like to say, making your life easy by making Medicare simple. Guys, if you don't have a professional agency or an agent, we'd love to be able to work with you. Schedule a time below, click, and then we'd love to be able to talk to you and walk you through and answer any questions that you may have.